Hi everybody, this is another Year 2 clinical placement question and answer short presentation. I hope you're all well. I've recorded it on PowerPoint this time, so hopefully you won't have any issues accessing it. And I've tried to take the questions from your emails over the last few days and the last week that I didn't answer yesterday, and I hope this helps with your placements. So what I thought I'd do is I would just summarise the placement requirements for both hospital, and also I've got a summary of the general practice, primary care and community placement requirements. And just to note, we have made a change to the primary care placement requirements today. This is following on from some updates received from Warwick University, and hopefully this is a positive thing which will make your sign-off much more easy to achieve. So I'll share that with you shortly. So basically for your hospital placements, so this is for your medicine, your surgery and your specialty community block. At the start of your placement, the initial meeting form that you need to request is a UOC meeting with your clinical personal tutor. Now, I had one email who says, is your clinical tutor your educational supervisor? And that's correct. On UMEP, it's your clinical personal tutor that needs to fill out this form. And although there are some sections that suggest, asking questions about financial, academic concerns, just ask your educational supervisor to fill in as they feel able to. That is the mandatory form you have to fill in at the start of your placement. There is also a UOC start of block reflection. This is for you to complete. This is optional. It's recommended because you can think about what your objectives are for the placement, what you're hoping to learn, but it's optional. And also, as mentioned, your mid-block review and feedback form is optional midpoint through the block, such as during weeks 4 to 5. But certainly if you were having any difficulties or you were concerned you weren't going to get all of your placement requirements signed off, I would suggest having this meeting with your supervisor. So what do you need to do in each 9-week core clinical education block? So for the hospital blocks, you need to undertake the following supervised learning events, or SLEs, or another phrase we've used is workplace-based assessments. So as mentioned in your logbook, in your handbook, which I would strongly advise you to read both of these entire documents in full, which I appreciate is a lot of reading. For each of your hospital or specialty/community placements, you need to undertake 1 mini-KEX, 1 case-based discussion and 1 OSLA per block. The OSLAs need to be done by at least an ST3 or a registrar, or you can use a clinical fellow or a consultant. And at least half of all of these assessments need to be done by a consultant. Therefore, I would suggest 2 out of these 3 forms are filled by consultants each block. The other requirement for your hospital placements is a minimum of 1 reflection per block. Within the community and specialty placement, I've asked you to undertake a reflection on your time spent at the LOCKS Centre, and I've suggested a word count of around 500 words for this, you will notice in the community and specialty handbook, but I would suggest a minimum word count of 250. As I said, up to 500 words, but certainly more if you'd like to. You can obviously reflect on more than this 1 reflection per block, and as I discussed in the last presentation, there's further guidance for what you can cover in your reflective practice in your logbook and in the previous lecture I gave in September. As mentioned, the community and specialty logbook, you need to ask your educational supervisor to physically sign off the community and specialty logbook sections and scan it into your UMEP personal library at the end of your placement or at the end of the year if you haven't managed to achieve all of the outcomes at the end of that block. If they don't physically sign that book, you'd need to get your educational supervisor to comment that they are happy you've achieved all those sign-off learning outcomes in the specialty and community logbook within the end of placement form. So for example, the supervisor might say, I am happy that Rose has achieved all the desired outcomes for older adult, child and maternal health for this placement. The reason we give you till the end of the year to get this done is that you might not see all of those presentations within your community specialty block, but through the academic blocks, through your medicine and surgical placement, you may have experiences that will make up for anything that you've not seen in that initial block. The end of block review and feedback faculty team form, that is your end of block supervisor form, is mandatory. You can use the community placement end of CCE review and feedback form, but you don't have to. So either one of those two forms is fine for your community and specialty block. For the medicine and surgery block, use the end of block review and feedback faculty form for your educational supervisor to fill in. In terms of the procedures, the clinical skills, these are the other things that you need to get signed off in each of your CCE blocks, and I went over this in the last Q&A lecture. There will be opportunity for dual sign-off, so you will undertake the clinical skills both in the clinical skills lab in the university and also at the hospitals you are on placement with. Within the hospital and primary/community care setting, we need to make sure that, as mentioned, each of the following are mentioned in some of your case-based discussions, mini-KEXs or student-led consultation logs which you undertake in primary care. So for example, in order to get signed off for children, older adult and women's health and complete your community and specialty handbook, it is strongly recommended that you need to complete some of your SLEs within the following area. So for example, if you are in primary care practice and you have a patient who needs a contraceptive discussion, I would advise you to link this with your women's health outcome in the community and specialty handbook. You might see a patient with the community healthy ageing team who has a memory problem, or a patient on the SDEC frailty unit who has a memory problem. You can ask for a case-based discussion and link this with your mental health learning outcomes. So probably the biggest change to make you aware of, and this is hot off the press today after Dr. Banks and I have been updated from our colleagues at Warwick, is that our colleagues at Warwick have made some changes to the placement requirements for the primary care and community placements, and so we are also able to update the number of assessments you need whilst on your Thursday placements. And you will be very pleased to hear that instead of asking for 54 consultations in total across the year, we have amended and decided to reduce this in line with Warwick to 18 consultations in total per year for your primary care placements. So based on this, you will be very happy to know you only need to complete one observed student-led consult form. So if you find this form on UMEP, you can see that there are space for 18 case summaries, reflections, learning points. And what you can do is you can start this on your placements and you can save it and complete it as you go throughout the year. Don't leave it all to the last minute. So hopefully this is a welcome announcement to you. You do need to undertake your 3 community reflections for the Thursday days Dr. Banks has organised, which are the third sector services in the community, the long-term condition and palliative care experience. The other placement requirements for your primary care days are exactly the same as previously outlined in the logbook and the handbook. So 3 OSLAs, 3 mini KEXs, 3 CBDs, and that's overall throughout the whole year. So as a guide, you want to do half of those in each of your clinical GP blocks. So when you're on your GP workshop days, you can't get those workplace-based assessments because you're not examining or talking about patients in a real clinical setting, because it's a simulated setting, but you can reflect on some of your consultations from the GP workshop days. As with your hospital placement, you also need an end of block GP sign-off, and you'll need to undertake an audit in your primary care placement. The other placement requirements are the same as outlined in your logbook and your handbook. So for your primary care, you need 2 brief interventions signed off in your portfolio, 1 for smoking, 1 for alcohol. That's across the whole year. And you also need 2 extended patient encounters across the whole year. And we'd encourage you to have one of them as a case-based discussion as well. And there's some suggestions there of what you can use for your extended patient encounters. So you will also have seen within the logbook there's an end of block formative assessment that'll be at the end of your 9-week block. This is completed online via Moodle, and it's MCQs and SAQs on the presentations you've learned about in your block. So you will get different questions depending on what block you're in. If you're in surgery, it'll be related to surgery, medicine related to medicine, for example. There will be a deadline for you to complete this exam. It's recommended that it's a closed book exam because it's about you testing your own knowledge and what you've learned on in your placements to make sure that you're on track. So my advice, as I've said before, please, please, please read that handbook, read that logbook in their entirety, and hopefully that will really help you. I think the more that you use UMEP and just have a look at opening forms, obviously don't create them, but just open them and have a look. Have a look at those logging of events. And the more that you log what you're doing, what you're learning, you can put as much reflective practice on there as you want, the better the system will work for you. You know, you could set yourself a little goal. Can you have a look on UMEP every day, every other day? Can you make sure you're completing an assessment a week? Something like that will really help you keep on track, because what you don't want to do is leave it all to the last minute and then find yourself in a pickle. Think about what you want to get out of each clinical session you're in as well. You may have noticed as well in the logbook, the therapeutic log is optional, but what I would say to you is it's that year 2 drug list which is going to be quite crucial for your exams. So tick off the drugs as you learn a bit about them or you see them used in clinical practice. Maybe you're on a respiratory ward and you've seen someone prescribe different inhalers, you know, treatments for acute asthma. A lot of questions I've had is also about the e-learning. So in relation to this, script is supportive that you engage with script. It's not mandatory. But as with the e-learning, if you are given specific time in your timetable to do script, we expect you to sit down and do that e-learning. If your educational supervisor was to question you, you had some script timetabling there, tell me about what you've done. If you say you've not done it and you've not followed the timetable, then that could be a concern. Similarly, with the sexual health and the learning, intellectual disability e-learning, you have to show us that you've engaged meaningfully in the time we've given you in the timetable to do this. And the educational supervisor might want to see specific evidence of that in the portfolio. As such, we do recommend that you log what you have done with that e-learning in your personal library. The other thing to say is the clinical cases and the presentation lists. So they're in your logbook, they're in the handbook. Maybe in the logbook, tick them off as you go and you see cases, and then that'll help you identify which areas you might want to ask clinical fellows or your educational supervisors for a bit more support with. And the other thing you can use UMEP for is documenting feedback. So you might get specific feedback on a case-based discussion, or you might want to reflect on it. What did someone say to you about your technique that you want to improve on? That can be really making UMEP work for you. So clinical skills, I have had some more questions about clinical skills. As I mentioned in the last talk, we have asked the hospitals within each of the different blocks to teach you these different clinical skills. So over the course of the year, you'll get taught these skills not only within the university, and some of them have been covered already, but also on your clinical placements. Some of you have mentioned that some of the hospitals are not providing certificates for their clinical skills teaching. That is okay, but what you will need to do in order to demonstrate you're competent at that clinical skill is you have to send whoever's taught you that skill a ticket on UMEP. So within the procedure tab, you can ticket them for that clinical skill. So say, for example, you're at Wrexham and they don't use certificates. You can ticket for they've taught you scrubbing and gowning, send an email to that person who's taught you that, and they sign you off. For those of you who do get certificates, you need to log the certificate in your personal library. You can take a photo of it on your phone and you can upload it to your personal library, but you also need to ticket those clinical skills to the person who's taught you to get you to sign everything off. And they will get lots of emails, but that's what they need to do. The other way to do it is you could have your educational supervisor, they're happy, they've seen your certificate that you've done blood sampling, venipuncture, ABGs, they're happy to sign off the procedure based on seeing your certificate. So that would be the other acceptable way. I had another question about if you were trained by a clinician in a clinical environment for example, patient observations, blood glucose monitoring, urinalysis, is this proof of training? So in response to that, I would say yes, if that person is appropriately trained to sign you off for urinalysis, then you can send them a ticket for that procedure skill, and you can use this as proof to show your educational supervisor, because you are also going to get training in the university to cover that. The only caveat to this is we say for your clinical skills, you have to be trained within a skills lab or non-patient facing environment before you practice that clinical skill on a real patient. So in terms of, for example, blood glucose monitoring, you cannot practice blood glucose monitoring on a patient until you've been signed off by someone in the clinical skills lab environment. Another thing that we've noticed is some of you are asking, well, I've done venipuncture in the university, can I do venipuncture at my local hospital? And what we would say is the local hospitals, they want to teach you their local procedures. So that is why we say you have to have clinical skills training in the hospital's clinical skills lab environment before you go and practice those skills on patients on the ward, because they want you to follow their own protocols and procedures. Any questions regarding clinical skills, please discuss this with the undergraduate placement leads within your hospitals to double check when they're teaching you and what their policies are. But once you have been signed off in the clinical skills lab, any suitably trained healthcare professional in the clinical setting can then observe you and sign you off with direct supervision. So, and just finally as well, UMEP. So Lee is doing lots of drop-ins to support you. There's one next Tuesday afternoon. If you can join it, you can email him as well. And the final thing I wanted to say is, which I hope you're all aware of, any serious concerns on placement, please be aware that on Moodle, on the forms tile, you can raise a concern if you've got any safety concerns or any serious concerns about your clinical placements. I also wanted to let you know that keep giving us your feedback as you are via email. we're potentially looking at ways that we might formulate a better system for you sending messages to us, just because we're getting lots of queries at the moment, but I appreciate you're all trying to understand what you need to do, and that's why I hope presentations such as this one will answer the majority of the questions you have, and please continue to keep learning, enjoy your placements, and I look forward to seeing you soon.